is the number always to call. And I know, Debbie, you had a couple things you wanted to hit
I
on.
do.
So
Well, first of all, I want to just say happy election day to everybody. I'm glad to hear that there have been strong early voting numbers and that lots of people are out there getting out the vote. Important day. So celebrating that along with the Cubs' victory. And
No.
I know Dr. Woods here is not was not rooting for the Cubs. I'm not going to hold that against him, but we can get back to that later. And with this, our show today is going to be sort of sports related, right, Dr. Woods?
That is correct. And I grew up in Ohio, so I am a Cleveland Indians fan for life. It's very difficult to lose 2 World Series in the seventh game in extra innings, so I apologize.
That's okay. Oh, now I see the Cubs
yeah, you can see
jackets
here that
coming out.
I'm not exactly a Cubs fan myself. So
Well, at our last show, our Flu Palooza show, where we were talking about the flu shot campaign that we have for our employees, I predicted that the Cubs were going to win. So if you go back and take a look at that, did you predict that the Cubs were going to win?
I did, but I was hoping I was wrong. So you got to use your head on predictions, but you use your heart when you're watching, right? So that's what I was doing at least. But like we talked about it at length, and the Cubs they were the best team in baseball year, and they proved it. So they deserved it. There's no doubt about it.
They did. It was a great game. It was really a super game, and I think a lot of people are a little sleep deprived right now because they were celebrating all week, and now they're getting ready for the election. But so that kind of brings me to one of the reasons that we're here. We're pitching a health fair that we have every other year. It's called "It is Important to Know Your Numbers." And we have a physician meet and greet along with the health fair with lots of vendors. You can get free screenings, which include cholesterol, A1C, blood pressure, balance, height, weight, BMI, and more. We are going to have a presentation on prescriptions, prescription drugs, and how doctors now are not prescribing as many antibiotics as they once did, and why. And there will be opportunity to meet some of the doctors. We've invited some of the doctors to show up for meet and greet. And that is in our main lobby of our hospital at 4321 First Street from 9 a.m. to 12 noon. So talking about new doctors, I have here today Dr. Dan Woods. Dr. Woods, tell us about yourself.
As I mentioned before, I grew up in Ohio, so there's my allegiance to the Indians. But I went through medical school, always wanting to do something that was involved with sports, and so that's what led me to sports medicine and orthopedics in particular. So I went through 5 years of orthopedic training and an extra year of fellowship to really focus in on sports medicine. And really, it's my passion is taking care of younger athletes, surgically and non-surgically. Many of the things that I do for patients is non-surgical, but it's really been my passion in life.
And I have so many questions I could ask you. We could go here the next half hour, and some of the stuff I have opinions on as a sports person, as a coach, and stuff that I've seen myself. But let's start with something simple. The biggest thing we've seen in sports, I think, one of the biggest rash of injuries is the ACL tear has been with pitchers, and with the UCL ligament damage they've constantly had. The Tommy John surgery is more and more common. What is your theory behind the reasoning of that?
I think the biggest reason for most of the Tommy John injuries and the UCL injuries has to do with overuse. And if you look specifically in younger age children, they should not be throwing 6 or 7 innings at a time. They should not be throwing 2 days in a row. They should not be doing those types of things. And I think saving the arms while the kids are younger, and one of the other main things that I think is problematic is not correcting young kids' form in throwing the baseball. There are many bad forms that people can use to throw the ball well. For example, sidearm, sometimes submarine underarm. Most of those things are not good for your elbow. And so I think correcting someone's form, working on core strength, and limiting the amount of innings that are pitched at a younger age can really save these kids' elbows.
And besides just pitching, obviously, I know one of the big discussions has been the use of breaking balls. I started throwing a breaking ball myself, and I never went anywhere with baseball, but I was an average ball player, made some all-star teams, this and that, but never college or anything like that. And I started throwing, and I know it's too early, but I didn't have velocity, so I started throwing one when I was 13. Never threw one in Little League, but got to Babe Ruth, and that extra feet you got to throw, obviously, that extra about 15 feet it is. from 46 to 60 feet 6 inches is a big difference. And I would maybe touch at my best when I was throwing my hardest, maybe touch 85, and I needed something to help. So a breaking ball, but guess what? I umpire now for over a decade, and I've seen these kids from ages doing all-stars, ages 10, 11, 12, even younger than that maybe. They're already throwing breaking balls. How much of an effect can that have, too?
That's a significant effect. I think really you should wait to throw those till mid-high school at minimum, and it shouldn't be every other pitch. It's one of those things that, again, it breaks the normal throwing form, and so it definitely puts more stress on the inside aspect of the elbow. So I would agree with you on that.
Yeah, and another thing, too, and this just isn't just a baseball thing. It's something I've seen in every sport. But I know it most because I coach baseball, and I can relate it there. But a lot of guys that I know who I watched grow up in Little League that were good ball players that could be playing baseball in high school have now they all become specialized. And whether it's a kid who was a really good young quick shortstop who's now just playing as the point guard on the basketball team, and that's all he does, doesn't play baseball anymore because why don't you play? Oh, I'm focusing on basketball. Well, to me, it's always been, unless you're at least going to be a Division I scholarship athlete, you need to play everything because you need to have an off season. And I know one of the big things they always talked to Mark Burley was the pitcher from used to be with the White Sox or with the Blue Jays at the end of his career, of course. He always said, "Why did you never have arm problems?" Well, I didn't pick up a baseball. Once the season was over, I didn't pick up a baseball until February. And how important is it to have those off seasons where in baseball, maybe you use your right arm if you're right-handed a lot, but then if you play basketball, you're obviously not using it the same way. You need to work those muscles. How important is that to have an off season?
I would think that is probably one of the most important points that a young kid can take away from what we're talking about today. Be well-rounded. If you are, a good athlete, play as many sports as you possibly can. What you mentioned about resting the arm in the off season, even throwing a football is not the same as throwing a baseball. It does not put as much stress on the elbow and the shoulder, and so things like that are extremely important. And an anecdote that I know personally because I am an Ohio State fan. Sorry, everyone. But Urban Meyer, 96% of the players that are on the football team play multiple sports. And so I think it's not even important to specialize, even if you plan on playing Division I sports. I think you should play as many sports as possible. It helps keep your body in shape. And also, like you mentioned, keep some of the toll of throwing a baseball or doing a specific motion off of that particular body part.
219-845-1100. This is the St. Catherine's Hospital Show. Debbie Grishecki is here. You've been hearing a lot from Dr. Dan Woods. And Dr. Woods, there's a good example. You don't even have to go to Ohio. There's always examples right in this area. And people forget about this, I think. There's Kawan Short, who is maybe an all-pro. I think he was an all-pro last year, defensive tackle for the Carolina Panthers, went to the Super Bowl. Well, guess what he was still doing his senior year of high school, still playing basketball. And he was obviously had a Division I scholarship. I believe he went to Purdue, if I'm not mistaken. Ryan would know he went to Purdue.
He did.
And then went and got drafted by the Panthers and has had a great career. But he was playing basketball all the way till he was committed to Purdue. And that's still something these kids can do. And I don't understand why more don't do it.
Well, even at St. Catherine's, there's behind the hospital, there's the Kenny Lofton Fields, and he played basketball at Arizona State. And so there are many, many examples. Again, obviously, a lot of people don't play Division I, II sports, but the bottom line is being well-rounded is extremely important as an athlete.
Yeah, and I know another one, a famous one, Jackie Robinson, UCLA three-sport athlete. But how involved are you? I think this might be a little bit out of your realm, maybe. I know a big problem with football has been with the concussions. How involved are you with that stuff?
So, again, I'm not extremely involved. A lot of the concussions has been taken over by the athletic trainers and some of the primary care physicians. But certainly I'm at many of the East Chicago football games, and that's one thing that we don't mess around with. If there are any signs and symptoms of a concussion, the player stops playing. There's a lot of information that's coming out, especially with the recent, NFL crackdown on concussions, that is very helpful in deciding, whether or not kids should continue playing. So I don't do a lot on that end, but certainly it's something that we follow very closely, especially in game.
One thing we found out is that Dr. Woods is very spot on and wants to be involved in the sports activities here in the region. As soon as he came on board, you were going to all the games, right? Tell us about that.
I started covering the East Chicago football games. They had a wonderful season this year. Unfortunately, it came up a little bit short in the playoffs against Munster, but the kids really played their hearts out, and it was great to get involved and see athletics the way it's supposed to be played, because high school is just so pure, and it's so fun to watch.
Absolutely, yeah. And if anybody has any questions, of course, please call in 219-845-1100. Can always call or text that line. If you have any questions for Dr. Woods or for Debbie Grishecki, be sure to call in and ask those questions. Now, we talked about the UCL with the arm problems in the elbow, but the ACL tear seems like, it goes in stretches, it seems. It's like this is the big-time injury. It's really common. All of a sudden, an ACL in college football and the NFL has just become it's all the time. It's like every Saturday and Sunday you unfortunately have to watch somebody get carted off with either an ACL or even an Achilles rupture. That some stuff I know, being a Cardinals fan, I watched. It's so easy to do that. You just take a common movement. And Adam Wainwright last year, just getting out of the batter's box, ruptured his Achilles. But these guys in football, what do you think can be done to stop the rash of injuries?
So that's a really difficult question, just because of the nature of football on the
Right.
whole. I don't want to completely pivot from the question, but there has been some research recently, specifically with women's soccer, because there's a higher incidence of women who end up with ACL injuries in high school. And so we have been able to decrease that incidence using what's called neuromuscular control, which is a specific training type. But with respect to football, I think the biggest thing that we can do is try to teach people how to hit properly, where they don't hit below the waist. But again, it is a contact sport, and unfortunately, these types of injuries happen. Now, the way we fix things has really improved over the last couple of years, and um, a good amount of these athletes are coming back, and I would never say that they come back stronger, but I would say that they can come back and retain the status that they were before, with not only the ACL reconstruction techniques, but also with the newest physical therapy techniques.
Yeah, and it's an interesting discussion because bouncing back a little bit with the concussion stuff too, and this ties right in with the ACL, is they've limited now in practice. I know they don't let you have pads on as much, and I think the idea was less contact, less chance for an injury. But it may be, I don't know how you feel about this, it may be working in a different way because a lot of coaches will tell you that you need more practice doing things the correct way and tackling the right way. And if you have pads on and you're hitting the right way, you might avoid those injuries more often.
Well, again, I think the impetus to doing that was specific to concussions,
Right.
because believe it or not, I was involved in an ACL study with the NFL, and the vast majority of the ACL injuries in the NFL are actually non-contact, which is kind of mind-blowing. You would think, a contact sport, but I would agree with you that I think I would say it's important to limit the amount of padded practices, and that's specific to head injuries more than anything else. And so I think that is good, but I also think we need to teach appropriate tackling styles and ways to protect yourself, basically, on the football field more than anything else. And I think that would help a little bit. Unfortunately, things like ACL braces and have not been shown to really decrease the incidence of injury. So it is a tough question.
Yeah, and I'm glad you brought that up because non-contact, when you hear that word when you're watching a broadcast and you hear, oh, there was no contact and the guy just went down, you go, oh my gosh, because you know what's going to happen. It's an ACL or it's Achilles, something ruptured there. Or if you get lucky, maybe just a meniscus or an MCL, just something more minor than those. But me and Ryan and Jimmy back here, we talk about it all the time. At least the last few weeks, it's come up that how much of a factor does turf potentially maybe play in those non-contact injuries?
So the newest field turfs are starting to improve. They're making the shock absorption a lot lower. When artificial turf was initially introduced, it was terrible, and there were a lot more injuries, and it doled out in studies that we performed. But with the newest field turf, it's thicker. It has more of a good shock absorption quality, and so I think it's going to be okay in the long run. But I agree with you 100%. The initial artificial turf was just absolutely not good for knees, and certainly probably caused a number of those non-contact injuries.
Yeah. St. Catherine's Hospital Show, 219-845-1100. Debbie Grishecki and Dr. Dan Woods are here, and we'll go to the phone line. Dave from Highland, you're on.
Hi, Doctor. I'm so glad you're involved in most doctors are there after the fact, right? After the injuries occurred, and you're there, before the injuries occur, which is great. I have a friend of mine that works in the Lake Central School Corporation, and in their middle schools, it might have started last year, but maybe this year, no tackle practices. And to me, playing high school football, how are you going to learn? And this is more of a policy issue for them and not directly to you, but it's all about technique, right? And teaching the right way to do things that you mentioned, upper body instead of lower body tackle, things like that. But to me, if you don't learn how to tackle, one, you're more prone to injure yourself and whoever you're tackling. So to me, it's no different than you said pads and the new improved turf. I've delivered a lot of fields. I've delivered the East Chicago field. I'm in the trucking industry. I delivered the field at Morton, and it's so much better. And they top dress them either with sand or these rubber pellets, so it is a lot softer than it used to be. But what do you think about going to a no tackle policy in practice? To me, that's you're just asking for injuries at game time.
I would tend to agree. I think it's a decent idea to limit the amount of tackling, but if you're not going to tackle at all during practice and then just go into a game, I don't think that's a great idea. I would agree with you.
Yeah. All right. Hey, thanks for coming on. I appreciate it.
You're very welcome.
Thank you, Dave. And we've talked a lot about all the stuff going on in sports, but let's flip it back to you just a little bit. I know you're obviously in the area now with the local high schools and stuff like that, and some guys, I can't remember his name. He actually went to the same high school as me, Highland. He was a trainer for the Cubs for a few years, and I don't know if obviously that's not the same thing. You don't want to go from being a doctor to a trainer, but they have now doctors who become affiliated with teams. Anywhere you see your career path going in that same direction?
We'll see. I will tell you that the athletic trainers are indispensable to what we do. Obviously, I would love to be at just about every sporting event, but we have great athletic trainers that work in conjunction with the hospital that are at every sporting event. They see every injury. They, are experts at diagnosing, saying, you know what, you're not able to play going forward, and bringing things that need to be seen to me. Obviously, like I said, I wish I could be there for all of them, but I can't. And so they are me on the field when I can't be there.
Absolutely. Again, we got a few minutes left, about 4 or 5 minutes, 219-845-1100. If anybody has any questions, Debbie Grishecki is here. You heard a lot from Dr. Dan Woods. And I don't know, Debbie, if you had anything else to add to the conversation?
Well, I just want to say that we're delighted that he's on board. He comes to us through the orthopedic specialists of Northwest Indiana. And Dr. Woods was a team doctor for the Flyers and the Philadelphia Eagles during his fellowship. So I want to let everybody know that. So if you ever want to ask him about some of the celebrity football players on those teams, you can. He's also, you don't want to share any stories? Okay, well, we'll save that for another time. And he will also be heading a new orthopedic surgery program at St. Catherine Hospital in East Chicago. So stay tuned for that. And I heard that Ray Garcia from El Taco Real is going to be bringing tacos in at the end of the election day.
Yes, that's what I heard.
For the vote tallies too,
yeah.
right? And based on the results, I don't know if do we need anybody to be here to do blood pressure readings or anything like that?
You're trying to get on tacos, yeah. That's a good question. You have to talk to Dave Kuziak about that. He'll be in later and might not want to share his El Taco Real.
Okay, so come on out to Know Your Numbers, our annual health fair. It's Saturday, November 12th, in the main lobby from 9 a.m. to noon. Physician meet and greet from 10:30 a.m. to noon. And you can get free screenings in the whole 9 yards. And thank you so much for having us.
Yes, I want to finish on one thing for Dr. Woods here. We still got a couple minutes, so I wanted to, one thing. For all the parents and then any young athletes who are hopefully listening, but parents that can relay it to their children. And maybe their parents, too, need to realize some of this, too, to relax a little bit on some stuff. But what can be done? You can never fully prevent injuries and stuff like that, but as far as training and warming up and preconditioning, stuff like that, what can possibly be done to at least try and limit as much as possible your chances for major injuries?
So that is really the quintessential thing that I would like to do, prevent folks from having to undergo things like ACL reconstruction, things like UCL reconstruction. It's not fun. It's a long recovery process. So the things you can do, and again, it's kind of body part specific, but if you start with the throwing motion, using an appropriate throwing motion, strengthening your core, making sure you're in shape, those are things that can really prevent injury. If you start talking about ACL injuries, again, recently, in probably the last 10 to 15 years, we've identified specific neuromuscular control techniques, landing techniques, jumping techniques that have actually decreased the number of ACL injuries in female athletes. And so these are the types of things, along with the normal stretching before you start working out, making sure that you're not overdoing it, working your way up with regular exercise. So all of those things are really, really important. But again, I think the most important thing that I can do is relay these new techniques that are available to try to prevent injuries.
Absolutely. Thank you, Dr. Woods. And before we go, how can people get a hold of you if they have some sports-related questions, maybe, stuff like that, or unfortunately, if something unfortunate does happen to them?
So I am available for new patients. I just recently moved to the area in the last month and a half, and so I do have openings. So I am currently seeing patients 3 days a week at St. Catherine's, and you can call 219-392-7664. That's 219-392-7664 if you'd like an appointment. Thank you.
Thank you, Doctor.
Thank
you,
you.
Debbie. And for Debbie Grishecki, Dr. Dan Woods, that was St. Catherine's Hospital. Up next, we have Raimundo Garcia. We'll be here with his EAT program just in a couple minutes here on The Voice of the Region.
Misprint has been the region's best source.
Junior, but I don't know if I get away with it.
Happy Election Day, everybody. I hope you've gone out to vote. This is the program called EAT. We're here to talk about food and food-related topics.
Must be the second Tuesday in November already.
Second Tuesday in November, 9 o'clock. That's it. We're here.
Trying to get a hold of that. We're over here at the 12:30 a.m., 104.7 FM, WJOB beautiful studios here, the Strachan Van Til Food Market Studios.
That's right. That's
over
right.
here at the Purdue University Northwest Commercialization and Manufacturing Excellence Center.
Man, say that 3 times fast.
Well, Ray noticed I had to look out the window to look at the sign to make sure I had a prompt to get that right. We're going to have a fun show today. We really are. We're gonna
By the way, not to cut you off, but I do want to encourage anybody that wants to call in about the politics. This is a very important political season, very important political day. If you want to call in and talk politics, well, we'll be glad to do that for you. But in the meantime, we'll talk about food and eating and things like that.
And we're talking about, in particular, kitchen utensils that are absolutely essential and gadgets.
And non-essential. I think we get a lot of calls, both Terry and myself. Terry, of course, was a professor at Ivy Tech for many years, chef for many, many years.